Hello, my name is Xavier Caro. I'm a rheumatologist and clinical immunologist here in Northridge, California. I'm also the director of the Southern California Fibromyalgia Research and Treatment Center. Welcome. We're discussing fibromyalgia and aspects of it that pertain to the treatment center specifically. In this segment, I'm going to try to describe to you how we interpret the abnormalities in the immune system, which I alluded to in my last tape. Now, these abnormalities are important for you to understand, but I'm going to try to keep them simple here so that you get the concept more than the actual figures. Should you like to know the figures as one of my patients, please do not hesitate to contact me or ask me when you're visiting the center. In any case, conceptually, I want you to understand that the amount of immune globulin that we have in our system doesn't vary that much from day to day unless we're under assault from some infectious or traumatic agent. But given just a routine, everyday bout of our lives, our immune globulin system stays pretty much the same. But some people are born with immune globulin levels which stay higher than others. Some people have rather low immune globulin levels. And it's our very strong suspicion here. In fact, we have data to back this up, and we've shared this data on a national stage about immune globulin levels in fibromyalgia patients. More specifically, these globulin levels tend to be low. We're talking again about these proteins that make up the humoral system, the humoral immune system. And if you recall, they include such things as IgG, immune globulin G, just a letter, and specifically their subclasses 1 through 4, IgA with subclasses 1 through 2, and IgM, and also, by the way, IgE. Here at the center, we also typically measure one component at least, and often 4 components of the immune system inflammatory cascade called complement. More specifically, we pay particular attention to mannose-binding lectin. Mannose-binding lectin, or MBL as I sometimes call it, is an initiator of this inflammatory cascade, and this particular protein is found deficient in a number of different patients. So we'll talk about that as we go along as well. Now, I would like you to understand that these proteins have an upper level of normal and a lower level of normal. Your laboratory, say if you're in another city with another practitioner, may list a level as normal, low, so that the practitioner is told if the level of the protein is slightly less, let us even just numerically 1 milligram per deciliter less, then the patient is told that they are immune deficient. But if it's just 1 milligram per deciliter more, they're told that they're normal, which doesn't really make great sense biologically. So this span of normal, how do we come up with it? The laboratory that reports the value is required by the FDA to measure and report statistically all the results of their measurements of immune globulins on all the samples that are sent to them. The problem with this approach is the samples sent to them are from those who are expected or suspected to have low or high levels. So the laboratory levels for low and high are normally relatively spurious. Here at the center, we use values which are published in gold standard textbooks. I particularly like Paul's textbook of immunology. And these levels are used to detect when patients have a low level of immune globulin. So say if Paul's level is listed at 50 and the laboratory is listed at, say, 30, we'll use the 50, and if you have, say, 49 or 48, you're definitely low or immune deficient. Furthermore, and this is conceptually important for you to understand, the normal range for whatever lab or whatever textbook you use can be thought of as made up of quartiles. That is, the first 25%, or if you like, the lowest 25%, then the next highest, say from 25% to 50%, and from 50 to 75 would be the third quartile, and the last from 75 to 100%, the fourth or highest quartile. It turns out, if you look at patients who have, for example, pneumonias, you will have more patients having pneumonias or severe pneumonias in the lowest most quartile compared to those in the higher quartiles. In other words, when you speak about immune deficiency, there is a spectrum from severely immune deficient, if you like, in this context, to more immune deficient. And that would include patients who are detectably low. They're below the level listed as normal by, say, textbooks such as Paul's, perhaps even the laboratory that's reporting. But also patients whose value falls within the lowermost quartile, that's the lowest most 25%, they're often sicker because they're more immune deficient than those who are in the higher quartiles. Now, interestingly, patients with fibromyalgia have more detectable immune deficiency for being strictly low or in the lowermost quartile than normal individuals. We feel this is very important. Now, our data shows that we have patients in almost every makeup of the immune globulin profile. We have patients who are low in every subclass or selected subclasses, in combinations of subclasses, and so on and so forth. The exact manipulation of those figures and the understanding of how they come together to produce a clinical picture is something we're still working on. But we do believe that these patients have a very significant immune deficiency and that this is important to their illness. More interestingly is we suspect that most, if not all, but most of the patients with fibromyalgia have had this kind of immune profile that's low in their humoral immune system since they were born. And in fact, this genetic problem, that is that which dictates their birth, probably runs in families. And we've found many other family members who have the same or similar kinds of problems with low immune globulin levels and with recurring infections. Now, from this, we predict, and we have found, by the way, that patients with fibromyalgia very commonly have a history of multiple infections going back many years. Often this is a sinus infection, but it can be pneumonias or other infections. Now you might say, well, I get it, Dr. Caro. Okay, we've got a low immune system, low immune globulin levels, more infections. Okay, I get it. But what's that got to do with fibromyalgia? I mean, you just said, Dr. Caro, you think it might be an immune problem, an immune inflammation problem, but you didn't say anything about infection. All right, very good. The problem with the immune system is, like a Swiss watch or a finely tuned car, if one component is missing or even low, the entire mechanism begins to wobble. And you get dysfunction, you get problems with the rest of the immune system. More specifically, three things happen when the immune system is not properly balanced. You get more or more severe infections than you would expect. You also may get autoimmunity. This is where the immune system goes haywire and begins attacking the person's own body. And this may have something to do with fibromyalgia. We'll talk about that. The last thing is cancer. You may notice more cancer than expected. This has been shown in many settings where immune deficiency is important. Now, to allay fears, should anyone be concerned about that last component, that is cancer, I'd like to reassure you that we counsel all our patients to merely carry out the normal screening, which is suggested by practitioners everywhere. If it's suggested, you have a pap smear, PSA, chest x-ray, digital examination, colonoscopy, whatever your practitioner, physician feels is appropriate, we think that's about the right way to go. On the other hand, there was recently a publication by Wallet et al. In a journal called PLOS 1, and they found that fibromyalgia patients do indeed have more, that is a greater prevalence, of a history of cancer than normal individuals. Interestingly, pancreatic cancer and liver cancer fell out more than other kinds of cancer. This preliminary data is very interesting and pretty intriguing to those of us who believe that the immune system is deficient in patients with fibromyalgia. Next, let's talk about how this dysfunction or insufficiency, deficiency, primary immune deficiency brings about what we would call fibromyalgia. Thank you.